And we go to our slides, and today we continue speaking about medication. And so this is the first page of the presentation where we can see some comments on homework. So as you remember, you were given the task to do some exercise with phrasal verbs, and one of them was to match some phrasal verbs with their meanings, and there were some mistakes in this task. So the typical mistakes are shown here, so there are 3 phrasal verbs: flare up, come around, and go around. So, and their meanings. So the meaning of flare up is suddenly appear or reappear. So then become conscious again, this is come around, and spread from person to person, this is go around. That we can say that some kind of infectious diseases go around some part of the city, for example, the country. And there were also mistakes in the use of the phrasal verb in this phrase. So which is given here: Elaine's rash began to clear out enough after she started using the cream. And you see that depending on the preposition on the particle, so the verb clear changes its meaning. If we have the phrasal verb clear out, it means to leave a place quickly, like it's given in the example. He cleared out with all the money and left her with the kids. So this is he left her, right? And so clear up means to become fine, to disappear when we speak about when we speak of illness, infection. And the example here is also the meaning can be used. This phrasal verb can be used in this meaning: the sky cleared up after the rain. As for clear in, it's actually not a phrasal verb. It mostly commonly used like a verb, a separate verb, and a preposition. And here there is an example of such use. The diagnosis was clear in the first phase of the country, you see. And so some of the students, okay, what is the correct phrasal verb? Which phrasal verb should be used in this sentence? Which preposition?
Clear up.
Clear up.
Clear up, clear up.
Clear up.
So this is, we have the name of the illness, and so it began to clear up. Okay, so we'll yes.
Can we use clear out?
No, because it was not a very fast process. Yes, I guess so. Okay, and yes, so we'll speak about some phrasal verbs today in details. And yes, I would like you to focus on what we were discussing at the previous class. We were listening to the conversation between a doctor and his patient when the patient was ready to go home, and the doctor was speaking about some medication that the patient should take after he has left the hospital, and he was speaking about the side effects and the benefits of aspirin. And so this is very popular medication, and so I hope you remember what the doctor said about this. And anyway, you know a lot about this medication. I would like you to use the phrases which are given here on this slide, like First aid just like to will help you a lot, so helps to prevent it, so on. And you remember that the doctor just at the end of the conversation, the doctor invited the patient to repeat the information with this phrase. So would you like to go through so the benefits and side effects one more time, just to check that to be sure that the patient remembers everything about aspirin. Okay, so
Excuse me, ma'am.
Yes.
Ma'am, in the Moodle site, there is a midterm test for today, but the deadline is 11:30 and it will
Yes.
take 1 hour to complete that. So are you going to extend the deadline for because the lecture is going on?
So this is, I opened access to this test for another group.
Okay, okay, ma'am.
So,
Okay, ma'am.
so did you start the test?
No, no, ma'am, because we were unaware about that.
Yes, sure, I know. So there are 4 groups. They are working with the same just a page of the site. I can't separate the groups on Moodle site. So all the students are given together. That is why I just open access to this test from time to time. So you'll get access after the class. Do you see? Mhm. Okay. So we were speaking about just describing aspirin, right? So please, what kind of sentences can you make? So in terms of aspirin, what can you say about aspirin using these phrases? Does anyone want to start?
Ma'am, may I?
Yes, picture, please.
Yes, ma'am. For the first one, which is the first, I would just like it can be like a chat, or maybe we can say any brief talking. So
Mhm.
I can frame the sentence as, first I would like to have a brief talk with you on the side effects.
Mhm.
That
And
makes sense.
benefits. Mhm.
Ma'am,
Okay. What?
it will be like that. First, I would like to prescribe or give you an aspirin, like that.
And so
Ma'am,
please, yes, develop the idea. Mhm.
yeah, ma'am. And that after that, ma'am, aspirin will help you a lot as it help in fever, like that. The second one.
Only in fever.
Yeah, ma'am, in fever, chill, etc. All the symptoms.
So, and you remember that what was the problem with the patient? What kind of disease did?
Coronary artery failure.
Cardiovascular.
Cardiovascular.
Yes.
Yeah.
Myocardial infarction.
Yes. Mhm. So it will
Myocardial
help.
infarction.
Okay, ma'am. Okay, ma'am. So it will
Ma'am,
be,
so
it will help you a
to,
lot in cardiovascular, etc.
it will help to ease your anxiousness, ma'am. It was
Mhm.
related to his anxiousness.
Mhm. Mhm. Okay. So there was idea like it thins the blood, yes, and
Yes, ma'am.
prevents the further heart attacks.
Thickening of blood. Yeah.
Yes, ma'am.
Okay.
And also, it was anti-inflammatory, so it will help to prevent the inflammation of arteries.
Mhm. Mhm. Okay. Maybe.
I have to just point out that there are some side effects of aspirin.
Okay.
Sometimes people get dizzy head.
Mm.
So
That would cause.
some side effects
It
are
can
shown.
make, yeah, dizziness, headaches, or it can make you feel like vomiting and
Mhm.
abdominal pain.
Mm. So we say that the doctor says that it can make you feel dizzy, or it can cause
Headaches, abdominal pain, muscle
abdominal
cramps.
pain. Yes. Mhm. Okay. Yes, you're right. Okay, good. So we'll speak about. Mhm. So in the conversation that the doctor used such phrase. One of the phrases which he used was like, would you like to go through all this information one more time? Yes. And we see that go through is a verb which is used with this particle, and it has the meaning just
To repeat.
to repeat. Yes, thank you.
Revise.
And, yes, and this is a phrasal verb. And now let us speak about phrasal verbs in details. And here is the example of a verb run, which is used with various different particles, and it changes its meaning. So if we use run with inter, it has run into, the meaning is to meet someone unexpectedly, like I ran into my English teacher at a shop. And run through, like the same as go through, very similar, like explain quickly here. Let me run through the schedule for the show. So, and run on, be powered by, like in the example, electric cars run on electricity, not gas. So the meaning of run up is spend a lot of money on credit, like in the sentence, I ran up a debt of £10,000 on my credit cards. And run out of means have none left. We need to buy more eggs because we have run out of them. Okay. And so if we have a look at the next slide, we can see the example from the conversation of a doctor to his patient. The doctor says there's a lot of information to take in at one time. And let us just focus on this phrasal verb, take in. This verb means to understand, and it is a so-called separable phrasal verb because you can separate the verb take and the particle in. It is difficult to take in information, so verb plus particle, they are used together. And it is difficult to take information in, so the verb and the particle are separated by the noun information, and it is also correct. And if we have a look at the next slide, there is information about the so-called inseparable phrasal verbs. So the example of such a verb is to get up, and they are called inseparable because you cannot separate the verb and the particle. Like in the example, if you can take the medication soon after you get up in the morning. Nothing can be used in between get and up. And so how can we understand which phrasal verbs are separable, which are inseparable? We need to analyze the meaning of the verb, because it depends on its meaning and depends on its form. So phrasal verbs can be like transitive and intransitive. So transitive phrasal verbs are verbs which have a direct object. So turn off, turn on or turn off the TV, look after somebody. And intransitive verbs are verbs which have no direct object. Like the previous get up, we can use it separately without any object. And you can see that so intransitive verbs are inseparable, and transitive verbs can be both separable and inseparable. Like in the example of separable transitive phrasal verb, turn off the TV, we can also use like turn it off. Instead of the TV, we replace it with the pronoun it. Or it can be also, some of them can be also inseparable, like I'll look after him. And if we move to the next slide, we can see some information about separable transitive phrasal verbs. And example is call the appointment of. As far as it is separable, so we can use the appointment between the verb and the particle. We can also use call off the appointment. This is correct. But if a phrasal verb is separable, it must be separated when its subject is a pronoun. If we replace the appointment with it, so it should be call it off. We can't say call off it. So the pronoun should be between the verb and the particle. So, and the information about inseparable transitive phrasal verbs example is given here. She is just starting to get over the flu. It means starting to recover. And you see the phrasal verb get over, and the flu is used after the phrasal verb. And it is also possible to say she's just starting to get over it. It is instead of stands for the flu. But we can't just use the flu or it between the verb and particle. She's just starting to get the flu over is incorrect. And so inseparable phrasal verbs which have no direct object, there are examples of such intransitive phrasal verbs. Like when we visited Paris, we loved eating out in the sidewalk cafes. Eat out means dine in a restaurant, so we do not separate them. And day after day, if rain showed up for class 20 minutes late, which means arrived in the classroom. So show up is also inseparable phrasal verb, which cannot be separated. And there are some phrasal verbs that always have to be separated, but this is comparatively rare. Like in the example, Oscar will take Sven up on the offer, just agreed to his offer. So we should use something between the verb and the particle. And so I think it's clear, and I would like you to have a look at the practical exercise where we need to rewrite sentences using the phrasal verbs from the box. Sometimes you may have to change the form of the verb, and you may be able to separate the particle from the verb. If we have a look at the first sentence, so Aman, will you read it?
The doctor identified a few benefits and a few side effects.
So we have to replace the verb. Where's the verb?
I will replace the identified word with the point out word. The doctor point out a few benefits and a few side effects.
Yes, pointed out. Yes, it should be
Pointed out.
Yes, okay, good, thank you. So please look at the other sentences and just rewrite them using the phrasal verb, a phrasal verb instead of the verb which is given in these sentences. So just 3 minutes to you. Start, please.
Done, ma'am.
You see? Just 1 minute. Okay. Let us listen to Apeksha. So read the second sentence.
Yes, please. Yes, ma'am. You could keep a pill box with the days of the week on it and remove the tablets each day. You could keep a pill box with days of week on it and take out the tablets each day. And it
Mhm.
can also be separated, like take the tablets out each day.
Mhm.
Second.
Okay, yes, good. Thank you. So, Misha, please.
Yes, ma'am. Completing a prescription requires a great care. Writing out a prescription requires a great care.
Mhm. Yes, we should use it in the form of the gerund. Okay. So, Nivas, please.
Yes, ma'am. Fourth one is don't forget to read the instructions on the label. After changing, we can say that don't forget to look at the instruction on the label.
Mhm, mhm. Good. So, and the next is Vandana. Vandana, are you here?
I think she's facing network issues, ma'am.
I see. Okay. Mhm. So, Priyesh, read it.
Ma'am, it is this one. Try to adopt a routine. Try to get into a routine for taking medication if you can.
Mhm. Okay, good. And Rakhav,
Mm.
number 6. Rakhav, hello. No, Rakhav. So, Ujwal, please. Ujwal. Minus. Sayonika. Sayonika. Guys, how many students are there?
Nine,
8
eight
students are
students
here
are
right
there,
now.
ma'am.
8 students. Rohit.
Yes, ma'am.
Mhm.
Contact the hospital immediately if anything changes. Get in touch with the hospital immediately if anything changes.
Okay, good. Thank you. So, Ritik.
Yes, ma'am. It works by reducing the workload of the heart. It works by the cut down the workload of the heart.
So we should add ing by
Cutting down.
cutting down. Okay, thank you. Good. So that was the exercise on phrasal verbs. And now it's time to speak in detail about what we started. Yes. Ujwal is coming. We started speaking about the concordance, and that was the term which we met in the article about nurse practitioner. And do you remember the meaning of concordance? What does it mean? Who can give definition to this?
Something like an index, so we can write immediately something on it, or like in short form.
And if we speak about concordance in prescribing medication, so this is what?
It look like to write a prescription in very short way,
And
And
to
this
read
concordance
immediately.
was used by the nurse, I guess, to get in touch with the doctor as well as the patient, like to be in the sync with both of them, I guess.
this is a kind of agreement of between a doctor
Yes,
and
yes.
patient, right?
And the
About
patient,
the taking the medication.
the
Okay.
medication.
So and so this concordance, this is a very just sad information about statistics. Let us read it. And so, Muhammad, will you read, please?
Yes, ma'am. Statistics for concordance in general practice in the UK. So, ma'am, sufficient concordance to attain the therapeutic objective occur about 50% of the time. And 1:6 patients take medicine exactly as directed. 1:3 take medications as direct 80 to 90% of the time. And 1:3 take medications 40 to 80% of the time. The remaining 16 17 take medication directly or less than 40% of the time. And 20% of prescriptions are never changed.
You see the effectiveness of concordance like is very poor, like only 50%. And so because of the patients who don't follow the prescriptions of so doctor, and so you see that even 20% do not even just take any of the medications which were prescribed by the doctor. And what do you think of the situation in your country? Is it similar to these statistics, or is it different?
Ma'am, it
It
is
is
similar to
different.
the statistics because many people over here are illiterate. So they feel like if I'm getting better, then they'll stop the medicines, but not understand that completing the prescribed medicine, the doses is really necessary. Like the antibiotics, there's an antibiotic called as azithromycin. It is necessary to take it in 3 doses. Generally, it is taken in 3 doses, but it's like after taking the first or the second dose, the congestion of the neck of the nose is like cleared out. So the patient doesn't take the third dose, which leads to the bacteria getting adapted
Antibiotic
to that
inactivity.
medicine.
Yes.
I mean, yeah,
Antibiotic
the
inactivity.
this leads to like when the next time the patient will suffer from the same disease, like the same cold, then the medicine needs to be extra dosage and not the same one,
Yes.
because the patient didn't clear his doses as prescribed.
Okay, thank you. So
May I,
yes.
may I elaborate this thing? Ma'am, basically, when we are talking about this point, she tried to mention a few points which got contradicted, ma'am. When we're talking about antibiotic inactivity and less dosage, see if a prescribed dose is for 3 days, and if we take 2 days, what happens is it actually stops the bacteria from multiplying, but it doesn't kills it. That's why we need to take the full dose. And when we're talking about antibiotic inactivity, it happens when a doctor prescribes a particular medicine in more power. I mean, if it is given at if a particular prescribed amount is 250 mg, I mean the person is weighing 50 kilograms, he'll be given 250 mg for 2 days, 3 days, sorry, 2 times a day, 3 days. And if the doctor prescribes him at the higher rate, I mean more than 500 mg for faster results and sort of stuff, then it happens that the body get used to the body antigen, the body leukocytes get used to the higher antibiotic course, and they actually respond at that level, and then the antibiotic inactivity in a particular patient starts growing. And for bacteria, ma'am, it is growing on a worldwide level. The bacteria are getting immune to antibiotics, and that's why the dose for antibiotic is increased day by day.
Yes, you are right.
It's a
Thank
concern,
you.
ma'am.
Yes, it's very important to understand it, but some people are not experts. That is why they don't follow these instructions.
Ma'am, they are experts. That's the current situation in our country. What happens? Everyone wants quick result. They don't rely on doctor. Even doctors are forced to work like this. They are like, I'm going to doctor for 5 days and nothing is happening. Doctors have nothing is happening. Please do something. And then doctor will be like, okay, I'm giving you higher medicine. Take this. And then this whole chain goes on and goes on.
Yeah, you are speaking about the experts that are experts that they get knowledge from the internet. So
no, ma'am, I'm talking about see, a doctor is actually an expert, and when he gives a medicine, he gives in a particular desired dose, I mean less dosage. But people over here are so much infuriated that they think that I'm going to a doctor, I'm spending money, and it's been 10 days and I'm not okay, I'm not feeling exuberant, I'm not feeling very good. So they'll go and question the doctor. Even doctor get frustrated, and then they prescribe higher medicine. And like this, it has become a particular habit that doctor actually prescribes higher medicine, more higher medicine as it is required, and then it is causing antibiotic inactivity in
yes, this
patients.
situation is just very common situation nowadays with the antibiotics.
Yes,
You're
ma'am.
right.
Yes, ma'am.
The situation is similar in our country, in short.
Yes, ma'am.
You're right. Okay.
It is greater than these numbers in
Yeah.
our country.
And the article which we are going to read, so this also just tries to explain something and give some piece of advice how to solve this problem. So let us read about concordance and listen to Aman. The first part is for you, please.
Non-compliance in medicine taking is a long-standing problem in all therapeutic areas, including the treatment of cancer. There is strong evidence that despite the introduction of new medicines, which have fewer side effects and are more convenient to use, many people still do not take them as prescribed. Even when not doing so, can have the life-threatening consequences.
Mm-hmm. So which disease is mentioned here?
Ma'am, cancer disease is
Cancer, yes.
mentioned here.
And new medicines, what features do they have?
Ma'am, in this treatment, it is important for a patient to be consistent, but the problem is described that the patient is not consistent here.
Okay.
And the proper treatment is only effective if the patient is more is using the medicines regularly and
Okay.
using the treatment as directed by the doctor.
I see, thank you. But what characteristics of new medications are mentioned in this part of the article? Why are they new? What's the difference between new medications and old ones?
Ma'am, in the new medications, there are fewer side effects
Yes.
as comparable to the older medicines.
Yes, okay, good.
And still
Yeah.
the people are not taking that because the fear is there if the medicine will cause any side effect or like that.
I see, okay. Let us continue reading and listen to Apeksha, the next part of the article.
Yes, ma'am. Medicines prescribed for the preventive purposes are especially likely not to be taken as prescribed. This may be because people do not feel immediately threatened, and in the case of symptomless conditions such as raised cholesterol levels and hypertension, feel no obvious benefit at the time when medicines are taken.
Mm-hmm. This is what we were speaking about, yes, before reading this article. So, next piece of information, please, for Misha.
Yes, ma'am. Factors associated with poor compliance includes complex regimens involving multiple doses and several medicines, unwanted side effects, concerns about the value or appropriateness of the taking medicines in particular context, denial of illness, especially among younger people, confusion or physical difficulties associated with the medicine taking, which are most frequently affect the older people.
Mm-hmm. So, which age groups are mentioned here?
Older people
And
younger people.
younger people, yes. Mm-hmm. Okay. So the next piece of information is for Nivas.
Yes, ma'am.
Mhm.
Effective ways of improving compliance rates involve the complementary use of educative, practical, and emotionally and behaviorally supportive interventions rather than the provision of information alone. There is evidence that regardless of the specific knowledge imparted, self-management programs which help to raise people's sense of self-efficacy and confidence promote better medicine taking.
Yes, sense of self-efficacy. Yes, so this is about the ways of improving concordance, as you see. So, and the next piece of information, Vandana is no, okay, Priyash, please.
Yes, ma'am. Ma'am, we are reading the concordance third part. Health professionals should respect patients' autonomy and accept that increasing compliance with prescribed instruction is not as important as meeting patients' individual needs and priorities. Patients need help to make informed choices about treatment. For example, there is a need to differentiate clearly between situations where varying the timing or quantity of medicine doses may do little harm or even be beneficial, and situations in which there is high probability of adverse clinical outcomes.
Mhm. So the key ideas are presented, are illustrated with the pictures here, like focusing on patient's
the
individual
dosage differentiation,
needs, yes, and informed choice
and
that the patient.
individuality per patient and how it is working on him, how the dosage should be increased and how the outcomes.
Mhm.
I mean, looking closely at the patient,
Yes.
introspecting the medication.
Okay, and so the next piece, the last piece of information, Rakhav. Sayonika.
Yes, ma'am. Improvements in self-management skills and compliance in medicines. Taking can generate significant benefits for individuals and the population as a whole. Combining medicines review with other forms of timely and appropriate support for patients and careers represents an important route towards better and more cost-effective use of medicines.
Mhm. Okay, so this is the information about concordance. So yes, we have only 1 minute left. That is why we'll stop. And so